job easier and in turn allow them to provide better care to patients, wouldn't you do it? Well, that's where the Access and Assist software comes in. Access and Assist is a new electronic data system and patient portal combined in one. Currently, there is a big issue of misdiagnosing in medical care. It has been found that each year in the US, approximately 12 million people are affected in some way by misdiagnosing. And one of the main reasons this happens is due to an ineffective electronic or paper system that is used to collect medical information from patients and also analyze them. It has been found that with the systems already put in place, doctors are spending half their day or more clicking pull-down menus or typing rather than interacting with patients, which has led to numerous situations where they misdiagnose their patient. With current systems right now, some of the difficulties that come with those systems are slow analysis rates, which means that doctors aren't able to find the information that they need as quickly as they would like in order to provide a quick, accurate diagnosis. And because they are spending so much time either trying to shift through all of the information through an electronic system or numerous files in a paper system, it has led to high doctor burnout rates. And because they are spending so much time doing this, they are spending less time interacting with their patients on a one-to-one basis, which altogether has led to hasty decisions and decisions made without the full information, which eventually lead to a misdiagnosis. From a patient herself, she said, "If the doctors I'd seen so often actually listened to me, I could have gotten a proper diagnosis years ago. Instead, they dismiss my concerns and comments." And this has to do somewhat with the issue that doctors don't spend as much time with their patients, but also that many of these systems don't allow patients to add information themselves or to provide a space where their concerns and comments will actually be recorded and not just heard and ignored. Misdiagnosing is something that has to be solved. It has been found that the human cost of diagnostic errors are between 40,000 and 80,000 deaths per year. Researchers have easier access to information about patients that will increase understanding of disease and its treatment. And this is one of the main reasons why a system that is effective for both doctors and patients is extremely important, and Access and Assist will be able to do this. With Access and Assist, you'll be able to quickly retrieve data on both the doctor's and patient's side. It will act as a patient portal where patients will be able to search through their own medical information and also be able to add to it. Doctors will be able to search for specific data or medical information or history that they want using keywords that they can put into a search that will shift through all of the data for them and be able to pull what the system thinks that they are looking for, and this will cut down on the time that doctors spend trying to find the information that they're looking for or add to it. By being able to collect all of this data at a much quicker rate and be able to analyze it much better, this will increase the understanding of the treatment required for a specific patient and allow doctors to accurately diagnose them and move forward with a treatment plan that will sustain their health. This will also increase patient advocacy because part of what the patient portal for the Access and Assist portion will be, it will allow patients a section in which they will be able to add concerns or comments about their health or any information that they feel their doctor should know that might be important to diagnosing them. This portion will be kept separate from any recorded official medical data, but doctors will be able to see this as soon as it is uploaded so that all the information that is required is stored and none of the information is lost. This makes Access and Assist the quicker, more effective data system that you need for your facility. This is a somewhat version of what it can look like from the doctor's end and from the patient's end. On the doctor's side of it, you will see a search engine that will allow doctors to shift through medical information much easier. They will have a section where they will be able to see what the patient has added on their end so that they can review it and make any suggestions on their treatment. They will be able to put aside any files that need reviewing in terms of making a diagnosis to make it easier to compile all the information in one spot. And they will also be able to have a section where they will record and keep track of any treatments that the patient is currently in the process of going through. And there will be numerous other sections that doctors will use to make their day-to-day activities in providing treatment easier. On the patient side, their patient portal will be accessible through any mobile device, including their phone, tablet, computer, anywhere where they can access the internet. And they will also be able to have a search bar where they can look for any of their information they're looking for. They will be able to have a record of all their visits so that they are assured that each and every visit is documented and all the information that is important is kept on file. There will be a section for the additions that they choose to make to their medical files that doctors will be able to review. It will be submitted as making sure all of the information is stated so that the information that is uploaded will be clear for the doctor to understand. So it will include the date of their last appointment or their upcoming appointment. It will be able to document any symptoms or experiences that they have prior to those appointments so that no information is lost from the time that they experience those symptoms to the time that they make it to the doctor. In the case that they don't make it that same day or it's going to be a few days before they can get into the medical facility. And it's going to be able to add any additional information that they feel their doctor should know. And this will be submitted to the doctor right away so that there will be no waiting period between the time that the doctor is able to see this information and the time that they submit it. There will also be a section where patients will be able to contact their doctor. Because doctors have a busy schedule, it may be some time before they are able to directly get into contact with the doctor, but on the doctor's side, they will be able to see any messages that patients send them as soon as they are able to. The cost of this product will be affordable. The aim for this project is to reach communities that do not have as advanced systems that they require for their facilities. Many a times there are communities that cannot afford to upgrade from, say, a paper system, and it is causing a negative impact on their patients. And this product will be able to help through that by not only being affordable, but also being effective in the way that doctors can use it. With this in mind, the starting price for this system will be about $5,000. And this will include the transfer of any existing files into our new Access and Assist system, which may take a little bit of time, and it will also include this installation of the system into all devices in the medical facility for all doctors. It will also include the setup of accounts for all the patients, which they will be able to do themselves if they would like. It will also include videos for patients so that they are able to better understand how to use the system so that it can provide the service that it is intended to. There will also be videos for doctors to watch who may also struggle with the system. However, the system is set up so that it will be the easiest to access and understand, and it will be in simple terms so that there is no confusion as to how to use it or where to find information. Saying with the idea that it will be used by communities who need it the most, especially. Price can be adjusted based on the medical facility size and the financial need of the specific community. Like I said, this charge will come to the medical facility itself, and it will be of no extra charge to patients to use, as the price will include the use for patients. And this is why access and assist should be included in your medical facility. Thank you.